Good day, everyone, and welcome. I am Dr. Yemonja Smalls, DDA State Director of Coordination of Community Services. Thank you for logging in to view this webinar training, which has been recorded for your review. At any point, you may download the PowerPoint for use within your agency. This presentation provides an overview of DDA's newly developed Supports and Services Planning tool, referred to as the SSP tool. The Coordinator of Community Services is responsible for completing it. As you are all aware, DDA is collaboratively working to transform and improve the quality of services provided to people with intellectual and developmental disabilities and their families and those who support them. In the past, people who had been determined eligible for services and placed on the DDA waiting list worked together with you, their CCS, to create a person-centered plan to be implemented while waiting to apply for waiver services. This tool is used as a waiting list evaluation, helps to determine current community services and resources, assess current needs and supports that a person might have, align current resources if available, and is used to reassess if current needs change. Effective October 19, 2018, the Supports and Services Planning tool will replace the person-centered plan only for those on the waiting list. While waiting, the SSP tool will be completed to assist the person in utilizing currently available supports and to identify needed supports and services that DDA may be able to provide to address the needs if the person is selected to apply for waiver services. Once selected to apply, however, a person-centered plan will need to be developed. The tool will be used to document the person's current services and support needs during a face-to-face interview with their assigned coordinator. The SSP tool should be completed within the first 45 days of a person being placed on the waiting list, effective October 19, 2018. Anyone who has been on the list prior to this date should have an SSP tool completed during their next quarterly monitoring and follow-up visit. The SSP tool will be used to document a person's current services and support needs, and this should take place during a face-to-face interview between the person and their identified circle of support, and of course you, the CCS. The process begins when DDA has determined the person is eligible for DDA services and has been placed on the waiting list. Once a CCS provider has been chosen, the assigned CCS should contact the person to schedule an in-person conversation. At this time, the CCS should encourage the person to invite members of their circle of support to participate as well. This should include the authorized representative or guardian parent, and may include friends, relatives, and those who know the person best. Even if they can't be present at the interview, still list them if the person feels that they are a person who can best speak to who they are as a person, add to their understanding of their life goals, strengths, and challenges. Similar to the person-centered plan, the SSP documents the person's goal for their good life. The Goals and Preferences section of the tool specifically looks to understand what that good life looks like for them from both their view and that of their circle of support. Coordinators, you want to ask questions that will help you understand what the person wants and does not want in their life. Remember, this is all about documenting the person's goals. Feedback from those who know the person well is important, as sometimes the person may not be able to articulate their desires or may struggle to share what they don't want in their life. Over time, a person may have changing goals and aspirations, and the needs and supports may need to be adjusted to reflect that change. For example, Janie wants to live in her own apartment, and she definitely wants to make a lot of pastries. As a young person, her family was really concerned about her learning basic hygiene skills so that she could do them independently. She's mastered those basic skills, and her planned goals have been adjusted to reflect her progress. Invite the person to describe what they do not want in their life as well. What do those close to the person believe they don't want? It's a careful balance to make sure that you've heard from both the person and their circle of support. When documenting what a person does not want, make sure to include the feedback from those that know them well. Be sensitive, as sometimes it may be challenging to say what's not working in the presence of support members. In this case, a person's indicated that they really want to spend more time with their best friend, they want to spend more time singing in their church choir, and they want to take some cooking classes. They want less time being alone. They don't want to go to a day program, and they definitely are not wanting someone to choose their daily schedule. What is the person good at doing? It may not be obvious to you, so make sure you're asking the person and those who know them best. Ask questions that will help identify the person's strengths, talents, and skills. In the employment and daily life section of the tool, you are asking questions to determine if the person has a desire to work and identify challenges that may make it difficult for them to participate in daily activities that they enjoy. The questions ask, are you currently working or have you worked in the past? If you aren't working, are you interested in working? If not, why not? If volunteering, you will want to know if the person would prefer working a job that paid them to do the similar volunteer activities. All people need support to live good lives. Using a combination of many different kinds of support helps to plot a trajectory towards an inclusive, quality community life. The integrated star is used in the SSP tool and will help to ensure that you assess areas of support that the person has in each of the categories, which include technology. Would the person benefit from the use of an iPad or a smartphone to communicate? Do they currently use any adaptive equipment? What are their community resources? Is the person attending school? Do they take public transportation or do they desire to? What church do they attend? Are there businesses or community establishments that the person chooses to frequent? Maybe they enjoy going to the library on Fridays. What are the person's personal strengths and assets? These may be determined from life experiences, observed social skills, education and training, and general personal knowledge. What relationships are established supports for the person? Family, friends, neighbors, coworkers, church members, and general acquaintances may be noted. You may need to edit the circle of support following this discussion. Remember, use the tool to engage the conversation. Again, it may be sometimes challenging for the person to discuss what's not working for them. Sometimes it may be directly related to a person or member of the circle of support. So encourage open dialogue and remember to remind the team how important it is to understand the person's perceived needs. You will want to document the perceived service and support needs from the person's perspective. Janie states, I love being able to fix my own meals. I especially like using the wok to make stir fry. When asked what's not working, she states, because there are stairs that lead into our kitchen, my mom has to plug the wok into the dining room. I wish it could go in the kitchen. Janie's circle supports confirm what she has shared. Janie really loves making her meals, especially since she would like to be a chef one day. What's not working is the entryway into our kitchen has steps, and even though the door is wide enough for her wheelchair, there's no way we can lift her chair up those 3 steps. Again, it is important to get a good picture of what is working and not working from both the person's point of view and those that know them best. This assists the CCS when it's time to think about potential services and supports that are currently needed. From listening to these concerns, what services might you think this person needs? Waiting list services. What public long-term services and supports does the person need now? The CCS should assist with getting referrals to public agencies like the Maryland Division of Rehabilitative Services and the Behavioral Health Administration. It is preferable that the person does not wait to receive DDA waiver services. The CCS should attempt to connect them with any local resources that may address their current needs. The service needs summary is used to document the person's current supports and services needs. In the past, it was common that people and families might request everything they could think of possibly needing, even if not a present need, in hopes of getting something approved. It is very important that the SSP document the current supports and services needs. If they change, the tool should be updated. In the first section, you should document what the person currently needs and wants. For example, this person would like to find a job working in the library. They inform you that they currently volunteer in the library on Fridays. You may have already noted this from completing the integrated STAR chart, so fill in their responses here. You will use the waiver services chart to identify what DDA waiver services address their current need. It will be important for you to be knowledgeable about what each one of these services provide so that you can pair their need with the appropriate service. Given that the person wants to find a job, you should already narrow the service need to a meaningful day service. At this point, they have already said that they are volunteering in the library and now want a job there. Employment discovery and customization services are time-limited services intended to identify and develop customized employment options for individuals working towards competitive integrative employment. Activities can include assessment of the community surrounding an individual's home, work skills and discovery activities to help identify an ideal condition for employment, including self-employment. So this is the best aligned DDA service which addresses the person's desired outcome to have a job working in the library. The supports and services tool is meant to be an accurate, current summary of the person's support and services needs. While there may be changes to the demographic information or circle of supports, the tool should only be updated when there are changes to the person's service and support needs. If no longer a need, for example, let's say the person was on the waiting list, they were actually able to get a job working at the library as a result of working with doors, you're going to update the tool and remove employment discovery and customization as a service need. If additional needs, supports arise, update the tool to reflect the change. Again, the tool should be completed within 45 days of the person being placed on the waiting list. But if already there, it should be completed during the next face-to-face quarterly monitoring and follow-up visit. Completion of the tool does not guarantee that a person will be selected to apply for waiver services. However, if and when they are, the CCS will be able to use this tool when assisting the person in applying for services and for completing the person-centered plan, because this tool has all the updated and currently needed services. If you have any questions in completing this tool, please reach out to your regional office for support. Thank you.